We started a transition coach program here at St. Mary Mercy Hospital in December of 2010 as a pilot. We started with 2 transition coaches. And through that project, we got connected with the Senior Alliance.
When we first started our care transition program, we started to identify that patients really needed access to community. We knew about Senior Alliance, but we really weren't sure how to work with them, and we started learning what they had to offer. Before we know it, we were on a phone call with them, and we were actually becoming part of a coalition.
The Senior Alliance got involved initially in care transitions work and looking at hospital relationships in 2010 when we were doing a research study on hospital discharge planning. And that kind of evolved into discovering the care transitions intervention out of Colorado and having more communication with the hospitals.
We knew that there was interest in the community to reduce readmissions, and we knew that St. Mary Mercy had been doing a pilot surrounding the coaching intervention. So we got together and not only did hospital-specific root cause analysis, but we looked at the community as a whole and did drill down into the root causes of why patients were readmitting and why the care was so fragmented in the community.
The other members of the coalition, the skilled nursing facilities, the home care agencies, the in-home caregiver agencies, it's really helped us to see each other more as equals. And not so much as the hospital being the dominant player and being the only person who has skin in the game.
One of the beauties of the Community Coalition is that there really have been these strong relationships built between care providers. You have a skilled nursing facility that can now pick up the phone and talk to somebody that they know from a home health agency or a hospital. It really benefits the patient with discharge planning and making their transfer as seamless as possible.
By working with our partners so closely in the coalition, I've truly been able to grasp what their needs are and how important key information is when a patient goes from home to the hospital. A current medical history and surgical history and medications, and understanding if a patient fell, for example, did they hit their head? Are they on a blood thinner? Did they have any loss of consciousness? Those were things, until I worked closely with my partners, that I could clearly understand how important it was. It saved the patient from many, many different tests that they didn't need to have.
You know, I've always, as I've been leading the coalition meetings, I've always tried to really encourage the concept that we're all really just equal partners, and the main focus being the patient, that it's our patient and we're all working together for that single good outcome for that patient.
You know, I've learned that there's a lot of terminology in the medical world that caregivers and patients weren't even familiar with. And so by working closely with them, we've been able to work on instructing patients in the home and family members how to understand different test procedures and different medications and key pieces of information that their medical providers need to know.
The fact that you can sit in a room and have people talking at you and presenting information and using acronyms, and everybody understands what everybody else is talking about. And a year and a half ago, we didn't. We all speak the same language now.
So one other real great benefit from the coalition is that I feel that it's really reducing fragmentation in healthcare. That you know, all of the agencies and facilities were providing you know, good healthcare in their own silos, but now coming together as true partners, and we're finding that there's so much more synergy of working together towards the same outcome.